We're going to get right into our discussion. So I am Dr. Sabine Elisee, board-certified family medicine physician. I am the CEO and co-founder of Cornerstone Medical Group. I help busy professionals get healthy and stay well. All right, and we're going to talk right into our subject today. Our subject today is breast cancer. Breast cancer. So go ahead and put breast cancer in that comment line, because I really want us to understand this and what we're talking about today. In the post that I wrote earlier, there is a common misconception that we have about breast cancer. And what that common misconception is that men cannot get breast cancer. And that is not true at all. It is not true. Men can get cancer. I just want to stop really quickly, say hi to Dr. Robert Hasty. So glad that you could join us. Today is actually one of my attendings, a great encourager, really inspired to be a great physician as well too. So I want to say hi and thank you for joining us, Dr. Hasty. So let's go right again into our topic. Again, we're talking about breast cancer. And we want to talk about the facts. You know, as a family medicine physician, I like to stay ahead of the game. I like to inform you as my patients of what's going on prior to its occurring. So every time we see that pink ribbon, we know we're getting into gear to speak about breast cancer. And a lot of times we have a lot of our male patients who feel like that can't affect them, but that is not true. In the United States only, over 2,200 men are diagnosed with breast cancer every single year. Every single year, over 2,200 men are diagnosed with breast cancer. And I want you to put this number actually in the comment box. 1 in 4. 1 in 4. If some of my Instagram people could go ahead and do that, my Tuesday Transformers on Instagram, go ahead and put in 1 in 4. And then I went ahead and put it in for our Facebook group, 1 in 4. Why is that number important? About 1 in 4 of the men who are diagnosed with breast cancer will actually die from breast cancer. So that's a huge disparity. And I always keep this in mind as someone who has a background in public health, is that's only the numbers that are reported. So some individuals, they just don't really say what's going on because, one, they may not have access to care. They're not getting the care that they need. But it's very important to know that men have breast tissue. And because men have breast tissue, if that tissue and those cells begin to overgrow, then that's cancer. And we want to be able to stay ahead of this. So what do we do? One of the most important things that you could do, whether you're a husband, a wife, a partner, a spouse, male or female, is to check your breast. Check your breast. I want you to put that in the comment line right there. Check. For our guys, I want you to check your chest. And then for the women, I want you to check your breast. It's something for myself, honestly. I'm taken aback how many times I have patients come into the office. They'll see me for the first time. And when we're doing that annual exam, I will go ahead and do a breast examination on them. For my male patients, I'll feel their chest as well too. And a lot of times, many of them say the same thing. Doc, Dr. Elisee, no one has ever done this. What's going on? I go a further step to actually showing them, particularly my women, how to do that. Why? Because no one knows your breast more than you. And you're going to be the person to know when something is different. Actually, let me change that. There sometimes is the case where a spouse, a significant other, a partner will be the one to feel something different, and that will bring a patient's attention to something's off, something's wrong. Something's off, something's wrong. So when you are checking your breast, you want to do that monthly. For our men, when you're checking your chest, you want to do that monthly, and you're looking for something that's as hard as a rock and doesn't move. That's that indication that, hey, this wasn't here before. The more that you do it, the more familiar you'll be with your chest area and your breast area, and then you'll know when something's off. There's this misconception that, well, it has to hurt, and then that could be an indication that there's something wrong. No, not necessarily so. We see sometimes patients will have growth that after we do further testing, it does in fact, unfortunately, lead to a diagnosis of a breast cancer, but it was never painful. And the reverse is true as well too. Just because it is painful doesn't necessarily mean that that has a cancer origin of some sort. So that's one of the biggest things. You want to check your chest, check your breast. And the more that you do that, we want you as women to do that monthly especially. The more that you do that, the more familiar you'll be with your chest area. And that way you'll know if something's off or is something wrong. So that's one of the biggest things. One of the second things I want to mention to my women in particularly, we spoke about this a few weeks ago, that ignorance is not bliss. Ignorance is not bliss, especially when it comes to your health. If there is something that you are feeling that is not correct, something that feels abnormal, something that you haven't felt before, you need to speak to your physician immediately. Breast pain is one of the things that really I have very, very low suspicion for. So when a woman comes in, and all physicians truly should have this same kind of rule of thumb, when a woman comes in and she's telling me she has breast pain, I really am paying attention to find out what's going on with that. And I want you to do the same thing too. I don't want you to ignore, my ladies, if you're having any breast pain. Don't ignore that. Do not ignore that. Okay, I think that's one to put in the comment line as well. Don't ignore breast pain. And the reason why you do not want to ignore breast pain is because, again, prevention. Family medicine physician here, background in public health, whatever we can prevent, that's what I'm talking about to my Tuesday Transformers. That's what I'm talking about in the office with my patients. I want to prevent certain things so that we don't have to go down that road. So if there's breast pain, if that's an indication that that could be something that's going on, an overgrowth of those cells, then I want to talk about it. I want to get in front of it. And that's part of the reason why we're not waiting till October to start talking about breast cancer awareness, but we're doing it right now. So once again, number one, check your breast. Men, you have breast tissue too. So you check your chest as well too. And we know that breast cancer in men is more fatal. It leads to the death in more men than in women because intuitively we just kind of think breast, we think women, and we automatically, for some men, they kind of turn off their minds and saying, hey, this doesn't really pertain to me, but it does. Not just if you have a wife or a sister or daughters, it pertains to you because men have breast tissue too. And because men have breast tissue too, they too can be affected with breast cancer. The last thing I want to talk to you guys about too, particularly our women, I want you to put the number 40 in that comment line. Put the number 40 in that comment line. That is the age of 40. I want all my women to remember this because, and I want the men to remember this too, so you'll be able to tell the women in your family or the women that you love at the age of 40 is when they should have at least their first mammogram. Their first mammogram must occur by the age of 40. Now, that is different. That age could be a little bit sooner if you have a family history, primary, what we say first degree relative, parents, siblings, children who have breast cancer, and then that age may change, okay, and get a little bit earlier. The specifics of that is really specific to what that history is. So that's why it's very important when we are asking these questions as a physician. When you come in and you give the history, we're asking key questions. We need to understand what your family history is because that changes a lot of the screening that we do, when we do it, and when it should be done. So I think that one of the biggest things I didn't realize when I was going to medical school or even in becoming a physician, that I'm not just a scientist. I feel like Sherlock Holmes investigator, and that history is what tells me all of that. Whatever my patient's telling me when I'm asking them about a family history, when I'm asking them about how they're feeling, it has everything to do with what my plan of care will be with you. So again, the age 40. When you turn 40, women, I want you to please promise me, especially my Tuesday Transformers, that you are going to make it a point to get your mammogram done. Why? When we know what's going on. When we know what's going on, then we know what actions we can take. When we don't know what's going on, then that's where the ignorance creates fear and creates panic. And something that could be a simple problem that could be resolved very quickly and simply grows into a big problem. And I'm specifically speaking about cancer, particularly breast cancer. My grandmother is a survivor of a breast cancer. She was a survivor of breast cancer. She has now passed away. And part of that is because we made sure, my mom did a great job in making sure, my grandmother was really good about this too, in making sure she had her breast exam, mammogram, and did her self-breast exam for herself as well too every month. So when she felt something that wasn't right, she told everyone. She told everyone. She told the doctors, she told us. I can remember as a child her telling me that something doesn't feel right, and that's what we need to do. We need to take a more active role in our health because it's ours, and we're the ones who are to be a good steward of it. And I love when I have my patients who come in and partner with me to take care of their health, because it really is a collaborative effort. So again, I'm so happy that you guys were able to join in. I want to say hi to fabulous Tasha, Rodney24, medical social group. Thanks for joining us. Financial King. You guys go check out Financial King when you get a chance. A wonderful, wonderful person to get your money management right. I want to say hi to Jackins Eugene. Again, 1 in 4. Yes, 1 in 4 men will actually die of breast cancer. And that happens annually. That's not over a 3-month time. I'm talking about every single year, 1 in 4 men will die of breast cancer. So of the 4 men, if there are 4 men who are diagnosed with breast cancer, 1 will die because they don't realize that could be the problem that's occurring. I also want to say hi also to Dr. Hasty, who's here as well too. So great for you guys to join us, as well as Kian DeJoan. And then if you think this video will be beneficial to someone, go ahead and share it. Go ahead and share it. So what are our key take-home points? 1, men get breast cancer too. Men get breast cancer too. And who will know more about your breast but you? Who will know more about your chest but you? So the more you do your self-examination, the more you'll realize month to month if something is off. And I want you to pay attention to that. Number 2, what was our key age? Our key age again was 40. So when you know someone's turning 40, particularly a woman, they might not be too happy about this, but I want you to make sure you write in that birthday card for them, go get your mammogram, because you will be saving possibly their life if they go ahead and get that information. I want to thank you guys again for joining on. I am Dr. Sabine Elisee, board certified family medicine physician, CEO and co-founder of Cornerstone Medical Group. I help busy professionals get healthy and stay well. Until next time, Tuesday Transformers, I will see you next week.